got so much fucking design on right now. Bring it down, bring it down, make it come out that thing, hold fast, I'm going with it. Bitches on the line, and you know.
Esok pula, atau lebih tepat lagi 12 Mei setiap tahun merupakan Hari Jururawat Sedunia. Menggalas tanggungjawab sebagai jururawat bukan satu tugas mudah. Apakah sebenarnya peranan jururawat dan sejauh mana stigma masyarakat terhadap sosok beruniform ini? Laporan rakan tugas Kairunisa Kasno.
A nurse's responsibilities extend beyond administering medications and performing medical procedures. At the heart of their role lies the ability to connect with patients, families, and colleagues through strong interpersonal skills. These skills are not just helpful, they are essential for ensuring quality care and building trust. One of the most essential interpersonal skills for a nurse is effective communication. Imagine a nurse named Siazli, assigned to care for a critically ill patient. The patient, an elderly man, is anxious and confused about his condition. Siazli sits beside him, gently holding his hand. With a calm and empathetic tone, he explains his treatment plan, using simple language to ensure he understands. He listens attentively as he shares his fears, offering reassurance through his words and presence. Siazli listens attentively without interrupting. He gives his the time he needs to voice his thoughts and feelings. After a pause, Siazli gently responds, "I completely understand how worrying this situation must be, but I want you to know that we're all here to take care of you. You are not alone, mister. We'll work together, step by step, to get you through this." Through effective communication, Siazli not only eases the patient's anxiety, but also fosters a sense of trust and comfort, which is critical for his emotional well-being. Second, showing empathy is another crucial interpersonal skill for nurses. Later that afternoon, Siazli enters his room to check on him after his procedure. He is lying down in bed, but he appears distant and quiet. Siazli immediately notices the shift in his demeanor. Siazli gently approaches, sitting beside the bed and giving him a moment to notice his presence before speaking. "Mister, how are you feeling now? Is there anything that's bothering you?" His sighs, his voice shaky. "I'm scared, Siazli. I'm not sure I'm strong enough for this." Siazli listens carefully, placing a reassuring hand on his arm. "It's okay to feel scared. You're not alone in this. We're here to help you every step of the way." He stays with him for a moment, offering comfort through his presence. He looks up, his eyes filled with gratitude. "Thank you, Siazli. That means a lot." Third, nurses also need to collaborate effectively with other healthcare professionals. Siazli was finishing up his notes when Nadia entered for the shift change. He briefly updated her on the situation with his patient, a young man scheduled for appendicitis surgery. He explained that the patient had been quiet, not fully expressing his pain, and Siazli suspected he was trying to act tough despite the discomfort. As Siazli spoke, he observed the patient's unease. He mentioned that the patient seemed nervous about the upcoming surgery and recommended that Nadia keep an eye on him, making sure he felt comfortable enough to communicate any concerns. Nadia listened attentively, noting the details of the patient's condition. She reassured Siazli that she would take care of him and make sure he was monitored closely. With a final nod, Siazli handed over the patient's care to Nadia, feeling confident she would provide the support the patient needed. As he left the room, he hoped the patient would soon feel more at ease in Nadia's care. Last, explain the medical report with a family member. The following day, after the patient had undergone the appendicitis surgery, Siazli was making his rounds when the patient's sister arrived to visit. She looked slightly anxious, clearly concerned for her brother. As Siazli approached her in the waiting area, he gave her a reassuring smile and introduced himself as the nurse in charge of her brother's care. He quickly explained that the surgery had gone smoothly and the patient was now in recovery. The patient's sister, still a little uneasy, asked if everything was going according to plan. Shiazli nodded, explaining that her brother was stable but still under observation. He told her that while the surgery was successful, the pain might take a little while to subside. He assured her that the medical team would keep a close watch on his condition and manage his discomfort as best as possible. As they spoke, Shiazli could sense the concern in the sister's voice. He acknowledged her worries and took the time to answer any questions she had about the recovery process, emphasizing that it was normal for the patient to feel some discomfort in the first few days. He also explained the post-operative care that would be necessary, ensuring her that her brother was in good hands. Shiazli's calm and thorough explanation seemed to ease the sister's concerns, and as she entered the patient's room to see her brother, she gave him a grateful look. Shiazli stepped back, confident that the rapport he had built with the family would help the patient recover more comfortably, knowing he had the support of his loved ones. Conclusion: interpersonal skills are the foundation of effective nursing. Shiazli's ability to communicate with empathy, provide emotional support, collaborate with his team, and building rapport with a family member exemplifies the qualities of an exceptional nurse. By mastering these skills, nurses like Shiazli make a profound impact, not just on the physical health of their patients, but on their emotional and mental well-being as well. Interpersonal skills are not an added bonus for a nurse. They are an indispensable part of their profession.